This is a Blend Extra, seniors and COVID-19. As we all know from the medical experts, seniors are at a higher risk due to age and medical conditions. So how can we help keep them stay safe? And is it better for them to be cared for at home?
Ruth Busalaki is the president and owner of Synergy Home Care, and she's here with more information on simple tasks that we can all do to help aging loved ones, neighbors, and friends. It was the Centers for Medicare and Medicaid Services that has identified a higher risk for people who are aging, living in communal settings. And that's why a lot of people are choosing right now to stay at home, right? Are you seeing that as pretty consistent with people that you talk to?
Yes, we are recognizing that ourselves, individuals who perhaps were considering moving to an assisted living or a communal living, have decided, at least at this point, to stay home, but they still need the support. So they're calling us to provide the options so that we can provide the supportive care and that they can maintain safety while still living at home.
Ruth, are you finding that during this pandemic that seniors are also more likely to be discharged earlier from places like hospitals as well as rehab facilities?
Yes, very much so. Those communal facilities and the hospitals and rehabs, they're doing everything they can to keep everyone safe. And so sometimes the best safe move is for them to be discharged a little bit early. But then that means they're going to need maybe a little bit more support when they do arrive home, at least temporarily until they get back on their feet. We categorize our care in two different ways. We look at caregiving. Some individuals do need help with transferring and mobility and those types of things. But more often than not, people need what I call a personal assistant. They need someone to help them around the house, help them with some errands, make some meals, do some laundry, really just small things that really can mean a lot in their safety and ability to stay home independently.
What are some of the new safety protocols that you guys have put in place? We saw in the video there, even wiping down surfaces, things like that.
So the very first thing that our caregivers are doing is before they arrive to every assignment, they're checking their own temperature and they're checking their own symptoms. We are asking them to do that prior to any shift. And if they have any symptoms at all, they call us so we can avoid having them go into their assignment. Once they arrive, they're asked to monitor the symptoms of their client as well. Traditional protective equipment like masks, we are providing if our caregivers are any closer than 6 feet to our clients. Of course, hand washing. And if they are running errands, we're suggesting they take their shoes off, or if they're perhaps running a lot of errands, they might even switch out their scrubs or their work uniform from one to another, just to really prevent any type of cross-contamination. One of the things that our families are very appreciative about is that we are wiping down those surfaces, probably more often than they ever were. It's a great extra layer of safety and cross-contamination prevention.
And I know it's a good idea for families, loved ones, to talk about the cost advantages, too, of staying at home versus being in assisted living care. So thank you so much for joining us, and we appreciate it.
You're welcome.
You can call Synergy Home Care for a resource assessment of your potential benefits. Call this number. It's 414-763-8368. The visit can be virtual, or for more information on all their services, check out their website at synergyhomecare.com.